Hello, everybody. Welcome to Sheena's Guides. Today I have got Sri with me, who is a pharmacist in UK. She has done the same route what our majority of my students who are watching my YouTube channel does it. She came as a pharmacist from India, done the OSPAP here, and now become a pharmacist and then gone and become a prescriber. So she will tell her journey in detail about to you. I think many of us has asked this question to give a couple of examples of the detailed journey from a pharmacist. And I have got Sri, who is, I think she will be well. I think you will get more information from here. Welcome, Sri.
Thank you, Sheena. Hello,
Uh,
everyone. So yeah, you want to know a detailed journey about how I became a pharmacist in the UK. So my pharmacy career actually started in India. I registered as a pharmacist in India after I completed my B pharmacy over there. And then I went on to work for a pharmaceutical MNC in India itself. And then I moved to the UK. When I came to the UK, I did my OSPAP at University of Sunderland, and I successfully completed my pre-registration in a community pharmacy with Lloyd's Pharmacy. After completion of my pre-registration, registering as a pharmacist in the UK, I've continued to work in the same sector, that is community, and I have been doing so for the past 1.5 decade. Whilst I've been working, I also pursued an independent prescribing course, and I went on to become a fully qualified independent prescriber, and also bought my own community pharmacy. And then to add to stuff, as if that wasn't enough, I ended up taking on a role as a practice-based GP pharmacist. And because of my experience in both community and the GP practice, what I ended up doing was I ended up getting myself chosen for a role that encompasses both the sectors. So I am currently my community pharmacy lead for the PCN that I serve.
I think let me start with first question. What majority of the students have asked? As you know, majority of the students are international students. They are either from India, Pakistan, or other international countries. So when you have done your studies in India, so comparing with that, how do you think the study in UK is? What does the students have to change? I know when I studied in India, I think I've been spoon fed, whereas when I did my master degree and masters here, I had to do it myself. I don't know, is it the same thing in pharmacy? So I think you would be able to tell us in detail what do they have to expect and how they have to change.
Yeah, so firstly, what I would like to tell people is only come to the UK to practice as a pharmacist if you have a real interest in improving the health outcomes of patients. Um, if it is a monetary thing, I wouldn't actually recommend it as much, although there is a monetary gain. So if you have that passion and if you want to do well, it does come with the added advantage of financial gain, obviously. We don't do any job for charity. So I would make that as the basis. Obviously, it's been a long time since I have been educated in India,
Yeah.
but most of my friends, my classmates, have went on to become professors and associate professors in many universities teaching pharmacy. And what I found out on my recent trip is the model of education, the way the studies are imparted in pharmacy sector over there still continues to be the same. It's very textbook learning. You have to basically mug up all the answers and you reproduce them on a piece of exam paper because there'll be set exams. It's um, um, quite rigid in its structure. And there is no room for interpretation. There is no room for asking why. Well, there is, but very limited. So one thing I would say to students who are coming over here is to make sure you keep asking the question why at every juncture, because that is the biggest tip I would give. And that brings us on to the type of the way education is delivered in UK, full stop. It doesn't matter whether it's pharmacy, nursing, primary, secondary. You need to do a lot of research yourself. You will be given a topic, you will be given some basic knowledge, background knowledge, but then you'll be given a project or a task where you have to go and find out what evidence is there to support the path you are suggesting, or the treatment you're suggesting, let's say, for example. The other thing what also happens here is we are a country which rely on guidelines quite heavily, and rightly so, because they have all been peer tested, peer reviewed, and all evidence based. Again, I don't think in India still there is guidelines. There may be formularies in each individual hospital or what have you, but when it comes to the whole nation following a similar guideline, I don't think that still exists over there. So people are taught about atrial fibrillation, the disease mechanism, just say, let's say, for example, treatment options, and there are multiple treatment options available. But here we are lucky to have a system which actually helps us in making those choices. So it's guidelines, evidence-based research, being very inquisitive as to why your lecturer or your professor is actually saying things, and that's very, very important. I'm not sure about nursing, Sheena, but in obviously I'm not a nurse, so you'll be able to kind of tell me if this is different. But the law in ethics is different, obviously, because it's a different country. The formulae, what the drugs do to the body is same across the world. That's not going to change. But how the law and the lawmakers have made those,
it is different.
Yeah, that's different. So come in with a mind that you will have to read very unexciting, very boring Law and Ethics. Dale and Appleby's Law and Ethics is your book to go to. So yeah, once you know your law, you're pretty much there.
I think what I say to my students who are doing the OSPAP is that at 2 years, 1 year of a OSPAP and 1 year of the pre-reg, give that 100%, and then and once you pass your GPSC, I know you still have to learn, but at least that's a big step.
Learning is a lifelong process. It never stops. And especially in healthcare sector, which I'm sure it's the same for nurses and GPs as well as pharmacists, we have to put in continuous professional development. Even like now, when I'm such an experienced qualified pharmacist, I still have to put in so many learning hours every year, because things change and new things develop all the time. So please have an open mind. That's what I would say, and be prepared to learn. That's when absolutely, Sheena, like how you said, 100% learning. What that 100% learning would be, not just finding out, right, this patient has got atrial fibrillation, they need to be on a DOAC, so this is my DOAC. You need to be able to apply that knowledge to practice. And so yeah, and it's quite people have a lot of respect for healthcare professionals in this country.
Absolutely.
And in order to maintain that respect and that position, and with every kind of highly held position comes with a great degree of responsibility. So we can't just tell them half-baked answers. We have to be well researched.
Absolutely.
So yeah, just think before you speak. Yeah.
I think when your patient knows that you have got that compassion as well as you're knowledgeable, I think they automatically come back to you, and that's what I have seen in my profession.
I agree. It's the same. You can't make up stuff, So yeah, learn what you have learned, like I say, in your pharmacy or B pharmacy, from your professions. Have that basic background knowledge. Come here and try to open up another portal in your brain, and it's beautiful once that starts. Once reasoning, it's basically reasoning. Once reasoning kind of sets in, patients will come flocking to you and they will have lots of respect for you, and it's quite rewarding. It's not something money can buy.
Thank you, Sri. Thank you very much. Thank you. So the next question comes after you. What sort of exams did you have at the end of OSPAP when you did the OSPAP? Probably things would
So
be different probably now, but when you did the OSPAP, what sort of exams did you do?
yeah, you're absolutely right. I think they are a lot different. And also, I think things are going to get even more different soon, because I think in 2026 onwards, we're going to be having pharmacists qualify as independent prescribers straight away, so that's a major difference. So things are evolving all the time. So when I did my OSPAP, that was a long time ago. I feel old, Sheena. Thanks for asking. Right. So I did obviously gave my IELTS. There was no OET at that time. So I had passed my IELTS, applied to the OSPAP, did the end of year exam with the University of Sunderland, the OSPAP exam. And that was one exam within all your subjects that you were being taught. We did not have OSCE. I'm being told by my pre-regis currently that they have got OSCEs.
Yeah.
So we did not have OSCE. Well, our OSCE was slightly different. It was called responding to symptoms. And we would have an examiner, we would have stations, but that wasn't as massive as what it is now. And it's a welcome measure that, University of Sunderland has moved on with times and is trying to prepare pharmacists for the future ready, future ready pharmacists. So yeah, I gave that exam. Then I did my 12-month, 52-week pre-registration program. During my pre-registration program, obviously, in addition to the tutor, I used to do a lot of, we used to attend sessions with a regional tutor. There used to be, I worked for a multiple company as a pre-reg, and they used to deliver the tutoring, make us ready for the exam. All I'm going to say is, and during pre-reg year, what all you learn in pre-reg year, your life is not going to be the same as it was in your pre-reg year once you qualify. It's completely different things. So pre-reg year prepares you for the registration exam, and it also teaches you the practical aspects, and that's what I learned. Passed my pre-reg, and then I gave the registration exam, which was very tough. And I don't think these guys actually going to sit an open book exam, but we had an open book exam. Not sure. I'll need to double check. But so yeah, the following day I had a massive headache because of the amount of concentration, no blinking, just constantly making sure you got your 100%. And also, I'm not sure if the calculation percentage is actually reduced now, because for us, if we did not get 100% in calculations, this was a straight fail. So we had to get 100% in our calculation exam. So we were told always to attempt our calculations first, because that was going to be the make or break, and then finish off your open book and then your closed book. But I think it's all closed book now, if I'm not wrong. But please refer to more recently qualified pharmacists for that. Yeah, sat my registration exam, and yeah, lo and behold, I passed, and I registered. The body with who I registered with doesn't actually exist now. It was called Royal Pharmaceutical Society of Great Britain. I'm showing my age now. And that got chopped into two, GPHC and RPS. So yeah, that's basically two exams that I gave for qualification, but numerous other exams during the year, internal exams and stuff like that I had to take, and presentations. Try and get more articulated. You might have all the knowledge up there, but you need to know how to kind of present. One of the tips I recently gave one of a pharmacy student who worked here for some work experience was, when you're given a case study, because you'll be given a lot of case studies during your OSPAP and during your pre-registration and during your exam, it'll be for a condition and you'll be given a case study. Don't explain everything what you're going to do to the patient and then back it up with guidelines. I would always go for the guidelines first. Let's say, for example, you're dealing with an asthmatic patient. you'll be taught that it is British Thoracic Society guidelines we follow. So you would start your answers or something like that with the British Thoracic Society sign guidelines state that this as the treatment, and then you would see how your patient fits. That is one valuable piece of advice I would like all students to make note of.
Sri, I think as we correctly said, this is our first video, and our next video will be followed by about GPHC and the difference between the different different settings like the hospital, community, and the GPHC, letting the students know more about it. Is that right?
Yeah, so yeah, that's absolutely right. And if anybody has any questions about these three sectors, I can talk the hind legs of a donkey about community and primary care, which is GPs, GP practice-based pharmacists, because I do both, and I have done during my pre-reg year also, again, something that's missing currently in my pre-reg year. We had to do cross-sector placement, so I have got a flair of what hospital pharmacy looks like. But I've also got lots of friends who work as hospital pharmacists, so obviously we'll compare all those three if your viewers so want us to kind of cover that, and I'm more than happy to.
I think what I would like my students or my viewers is that if you have any burning any questions regarding anything about placements, or regarding the difference between the different three settings, or anything about pharmacy, please post in. Either send it via as an email to me, or send it, put it on the comment box, and in my next question we'll have we'll have a question answered. I'm not going to say tell your name or anything. I'm just going to say these are the questions being asked, and first we'll go through the questions, and then we will go and we will do the further video about that. Yeah, I think is that okay, Sri?
Absolutely, yeah. Anything to help you guys. And one thing what we were discussing, people, is me and you were discussing, Sheena, was there seems to be a lot of negative publicity about community.
Yeah, definitely.
Yeah, I'm gonna tell you something. Community is the bread and butter of pharmacy. Without
Yes.
community, pharmacists are not going to stand, and community pharmacy is actually going through major roadworks, and it's going through a lot of change at the minute, where it's going to become very clinical in the near future, especially with all pharmacists soon to qualify as independent prescribers. So
Yeah.
we need to have clinical brains on. Yeah.
Yeah, I think, yeah, that's what different, because down from, if you look from India, it is totally a different structure what we have in UK. So I think getting that knowledge, because when you're staying in, you think that everywhere is the same, but it's totally a different structure, and you just rely on the videos what's been put on, or rely on a piece of information what others are being given. So I think getting that right information would be better. So post in your questions to us, and we will discuss that in the next video, and this video will be coming into you in few days time. Is that okay, Sri?
Yeah.
Yeah. Thank you very much, Sri. Thank you very much. Thanks everyone for watching my YouTube channel. Thank you.
Thank you. Bye.
Bye.